and today I'm giving you 10 chronic kidney disease symptoms you should refuse to ignore. I'm a board-certified kidney doctor, and one of the most painful parts of my career is when I see patients with kidney failure that could have been prevented had only they recognized the early symptoms. And the mind-blowing thing is that the top 2 causes of kidney failure, the top 2 reasons that people end up in my dialysis units, are largely preventable, or at least manageable. The good news is that there are ways to detect kidney disease early and to prevent, or at least to slow down the progression of kidney disease. What is CKD, or chronic kidney disease? Well, CKD occurs when you have damage or a decrease in your kidney function for 3 months or more. At that 3-month mark, it's when we call it chronic kidney disease. Now, there are multiple causes of CKD. The top 2 are diabetes and high blood pressure. And we're able to determine if you have CKD really based on your blood work. When you get a BMP, or a basic metabolic panel, it has your creatinine there, and it also has your eGFR, estimated glomerular filtration rate. And depending on what that GFR is, that's how we stage your kidneys and determine whether or not you have CKD. Be sure to watch my video on CKD stages after you finish watching this video. So your kidneys are your 2 organs located in your lower back or your flanks where the love handles are. And quite honestly, they are really underrated. They don't get enough press. Yes, I am biased because I'm a kidney doctor, but the kidneys are super important. Not only do they filter out your excess fluid from your body, they help to maintain your balance of your electrolytes, they help to maintain your blood pressure, they also help to keep you from being anemic, and they help to promote good bone health. And here's the real kicker. If both your kidneys fail, then you cannot live unless you have another form of kidney replacement therapy like dialysis or a transplant. But honestly, if you can, wouldn't you want to prevent getting to the point of needing dialysis or transplant? The wonderful thing is that if you recognize the symptoms of kidney disease, in many cases you can. So that's what we'll be getting into in this video. So now here are 10 CKD signs and symptoms. And it's really important that you recognize them because if you're not careful, it's easy to be in denial or to dismiss them and say, oh, I just slept wrong, or oh, I've just been working too hard lately. You can always come up with a reason. But you really want to pay attention because if you or a loved one is experiencing these signs or symptoms of kidney disease, then it's possible that if you catch them early and you seek medical attention, you could literally prevent going into kidney failure. Number 1, high blood pressure or hypertension. And this is really interesting because in this case, it's like what came first, the chicken or the egg? Because high blood pressure can definitely cause kidney disease, but having kidney disease in and of itself can cause high blood pressure. And remember, by definition, you have high blood pressure if that top number or systolic is greater than or equal to 130, or if that bottom number, the diastolic blood pressure, is greater than or equal to 80. And if you have this high blood pressure, you want to make sure that your doctor does further tests to find out if kidney disease is the cause of the high blood pressure. Number 2, swollen feet and ankles. Yes, having swollen feet and ankles, a lot of people may get them at the end of the day, or they may say, oh, it's because I had a little bit, too much salt, or I was on my feet too much. Okay, you can come up with a million reasons, but guess what? You don't want to miss this reason because chronic kidney disease could be the reason for swollen feet and ankles. So yes, you can have swelling or edema of the feet, the ankles, the legs, even of the entire body, a generalized edema or an anasarca. You can also get puffiness of the eyes. And this occurs in chronic kidney disease when your salt balance is not proper. You could be holding on to salt, which makes you hold on to more fluid in your tissues, causing a puffiness or the swelling of the feet and ankles. The swelling can also happen in CKD if you've gotten to the point where you're not making enough urine, so you're holding on to excess fluid, and this is causing you to have the swollen feet and ankles. Or if you have a form of CKD that causes protein leakage, which can cause a swelling in your body. Number 3, foamy or dark urine. Oh yeah, so these are really, really important symptoms of CKD because if your urine is foamy, that could mean that you have excess protein in your urine. So it's normal to have 0 or very minimal protein in the urine. If you have excess protein in the urine, it can cause a foaminess when the urine hits the toilet. And I don't mean just a couple of little bubbles here and there. I mean really foamy, like in those beer commercials when you see that white foam when the beer is being poured into the glass. Yeah, foamy like that. So if you see foam in your urine, this could definitely be a sign that you have CKD. Also, if you have a dark urine or something that looks like it could be blood in the urine, or if it's Coca-Cola colored, this could mean that your kidneys are leaking out red blood cells. It is not normal for the kidneys to leak out red blood cells. And if so, that is a sign of damage and definitely could be one of the signs of CKD. Number 4, fatigue. Now, of course, there are so many things that can cause fatigue and you just, being sleepy all the time. 1, it could be because your body is holding on to excess poisons or toxins, and those are causing you to have fatigue or be excessively tired. Also, in CKD, you could have anemia. Remember, I told you that the kidneys are responsible for helping to prevent anemia. So if you have anemia or low blood, this can cause fatigue, and this could be one of those warning symptoms of CKD. Number 5, shortness of breath. You can get shortness of breath in CKD, one, just because you're fatigued and just, trying to move or walk can make you tired. But also, if you have CKD and you're not making enough urine, you can have a backup of fluid in your body and you can get fluid in the lungs or pulmonary edema. This can certainly make you short of breath. Another thing, the anemia. When you have anemia or low blood, then your tissues are not getting all of the oxygen they should get. You see, your red blood cells act like cars, which carry your oxygen to your tissues. If you have anemia associated with CKD and you're not getting enough oxygen, this can lead to fatigue, which can lead to shortness of breath. Number 6, loss of appetite or even weight loss. Now, this one is really something that I see quite often. It's one that's easily masked. I'll have patients who come in to see me and they will have CKD, but they'll tell me, oh yeah, I lost weight. I've been trying to lose weight for years. And I guess, now I have portion control. I'm just not eating as much. And they may tell themselves or really think that they're losing the weight on purpose. So if you have CKD, this can cause a buildup of excess toxins in your body, which can cause you to have a poor appetite or nausea or vomiting or unintentional weight loss. If this is happening to you, it could be a sign of CKD.